Right now, as you're sitting and watching this, your legs may already be sending you quiet distress signals. Not dramatic pain. Not something that forces you to stop. Just subtle signs that are easy to dismiss. A heaviness in your calves when you stand up. A strange numbness in your feet at night. Cold toes that seem disconnected from the rest of your body. Most people over 60 shrug these off as normal aging. In Japan, doctors see them very differently. I'm not here to frighten you. I'm here to prevent regret. Because poor leg circulation doesn't usually announce itself loudly. It creeps in slowly, year by year, until one day walking becomes exhausting, balance feels uncertain, and wounds take far longer to heal. By the time many people realize something is wrong, the damage has already progressed. Here's what's rarely explained clearly. Circulation problems in the legs are not just about comfort. They are about oxygen delivery, tissue survival, and independence. When blood flow to the lower limbs decreases, muscles weaken, nerves suffer, and the skin becomes fragile. Healing slows. Infections become more dangerous. Falls become more likely. In Japan, this chain reaction is considered one of the earliest mobility warning systems of aging. Global medical data confirms this concern. Peripheral artery disease, the clinical term for reduced blood flow to the legs, affects hundreds of millions of people worldwide. And nearly half of them don't know they have it. They assume their pain is arthritis. They assume their slow pace is inevitable. They assume stiffness is just the price of getting older. Japanese clinicians are trained to question those assumptions early. One reason this problem is missed so often in Western countries is the way symptoms are interpreted. The focus is usually on pain management rather than blood flow restoration. If your legs hurt, you're told to rest more. If walking is uncomfortable, you're encouraged to take it easy. But circulation does not improve with inactivity. In fact, prolonged sitting and reduced movement accelerate the decline. In Japan, there is a very different cultural understanding of aging legs. Walking ability is treated as a vital sign, just like blood pressure or heart rate. Losing walking endurance is seen as reversible, not inevitable. Japanese longevity clinics track how long older adults can walk without discomfort, how quickly their legs recover after effort, and how warm their feet remain throughout the day. These details matter. Another critical misunderstanding is the idea that leg circulation problems only affect people with diabetes or severe heart disease. That simply isn't true. Aging alone changes blood vessels. Arteries gradually stiffen. Veins lose elasticity. The calf muscles, which act as a powerful pump to push blood back toward the heart, weaken if they aren't used properly. This process happens quietly, especially after retirement when daily movement drops sharply. In Japan, doctors often explain the legs as a system, not separate parts. Blood must travel down against narrowing arteries, then fight gravity on the way back up. If either direction fails, problems begin. Sitting for long hours allows blood to pool in the lower legs. Walking incorrectly or too gently fails to stimulate circulation. Over time, the system adapts downward. What makes this especially dangerous is how slowly it progresses. You don't wake up one morning unable to walk. You walk a little less each year. You rest a little more often. You choose elevators instead of stairs. You avoid longer outings. Each choice feels reasonable. Together, they create decline. Japanese research into aging populations has shown that mobility loss often begins years before any formal diagnosis. Long before a doctor mentions circulation, the body is already compensating. Balance worsens. Reaction time slows. Feet become less responsive. These are not separate issues. They are connected through blood flow. There is also a psychological component. Many older adults are afraid to move through discomfort. Pain is interpreted as damage. In Japan, mild discomfort during movement is often reframed as feedback, not danger. This distinction changes everything. Avoiding movement out of fear accelerates vascular decline. Guided, intentional movement reverses it. Another overlooked factor is footwear and posture. Traditional Japanese lifestyles historically involved more barefoot time, floor sitting, squatting, and frequent position changes. These habits naturally activated the lower leg muscles throughout the day. Modern life has reduced this stimulation dramatically, especially in Western societies where chairs dominate every environment. None of this means decline is unavoidable. In fact, Japanese longevity studies repeatedly show that leg circulation responds remarkably well to the right kind of stimulus, even after 60, 70, or beyond. Blood vessels are adaptable. Muscles can relearn their pumping role. The body is far more resilient than we are often led to believe. The tragedy is not aging legs. The tragedy is misunderstanding them. If you've noticed heaviness, numbness, slow healing, or increasing fatigue when walking, your legs are not failing you. They are communicating. They are asking for targeted help, not rest, not avoidance, not resignation. In the next part, we'll begin breaking down the exact movements Japanese vascular specialists prioritize to restore blood flow safely and effectively. These are not extreme workouts. They are precise, purposeful actions designed to wake up what has gone dormant. For now, understand this one truth. Poor leg circulation after 60 is common, but it is not normal. And it is certainly not something you have to accept. In Western health culture, leg circulation after 60 is often approached with the wrong mindset. The default advice is usually passive. Sit more. Elevate your legs. Wear compression socks. Take medication and avoid discomfort. While some of these measures can reduce symptoms temporarily, they rarely address the core problem. Circulation does not improve through passivity. Blood flow improves through intelligent activation. Japanese vascular specialists approach the issue from the opposite direction. Instead of asking, how do we reduce symptoms? They ask, how do we restore the pumping system? Because circulation in the legs is not driven by the heart alone. It depends heavily on the muscles of the lower body, especially the calves and thighs, to actively move blood back upward. In Japan, the calf muscles are often referred to as the second heart, not metaphorically, but functionally. Every time your ankle moves or your heel lifts, these muscles squeeze deep veins and push blood upward against gravity. When these muscles become inactive, blood stagnates. Swelling increases. Oxygen delivery drops. Over time, tissues suffer. One major mistake many older adults make is walking too gently. Slow, cautious walking without proper muscle engagement does very little for circulation. Japanese gait studies have shown that shuffling steps, common in aging populations, fail to activate the calf pump adequately. The result is movement without benefit. You feel tired, but circulation doesn't improve. This is why Japanese rehabilitation focuses on specific movement patterns rather than general activity. It's not about how long you move. It's about which muscles you activate and how consistently you do it. Even short sessions, when done correctly, can dramatically improve blood flow. Let's start with the simplest foundation, ankle movement. In Japan, ankle mobility is treated as a daily hygiene practice for older adults, much like brushing teeth. Ankle pumps and controlled ankle circles are prescribed not only after surgery, but as preventive medicine. These movements directly stimulate venous return and reduce blood pooling in the lower legs. When the ankle flexes and extends, the calf muscles contract rhythmically. This action increases blood velocity through deep veins and reduces pressure buildup. Japanese clinical observations show that people who maintain ankle mobility into their later years experience fewer nighttime cramps, warmer feet, and better balance. Another critical element is thigh activation. The large muscles at the front of the thighs act as massive blood reservoirs. When they contract, they help propel blood throughout the entire lower limb. In Japanese elder fitness programs, seated leg extensions are emphasized because they allow safe, controlled activation without balance risk. Unlike Western approaches that often separate strength training from circulation, Japanese protocols merge the two. Strength is not pursued for appearance or muscle size, but for vascular function. Contracting the thigh muscles triggers the release of nitric oxide, a compound that relaxes blood vessels and improves flow for hours after the movement ends. Standing movements are introduced carefully and intentionally. One of the most valued exercises in Japanese circulation therapy is the heel raise. Rising onto the toes forces the calf muscles to work against body weight and gravity, creating a powerful pumping effect. This is not rushed. Slow, controlled lifting and lowering is essential. Japanese practitioners often cue patients to feel the blood move, encouraging awareness rather than distraction. This mind-body focus improves neuromuscular coordination and reinforces proper engagement. Over time, this leads to more efficient circulation even during daily activities like walking or climbing stairs. Another major difference between Western and Japanese approaches is the rejection of long, uninterrupted sitting. In Japan, prolonged sitting is considered harmful to vascular health, regardless of age. Older adults are encouraged to break sitting time every 20 to 30 minutes with brief leg activation. Even 1 or 2 minutes of movement can reset circulation. Cycling motions play an important role as well. Whether on a recumbent bike or simulated while lying down, cycling creates continuous rhythmic contractions that train blood vessels to respond more efficiently. The seated or reclined position also reduces gravitational resistance, allowing older adults to move longer without strain. Japanese studies have shown that rhythmic leg movements improve endothelial function, the health of the inner lining of blood vessels. This lining determines how well vessels expand and contract. Improved endothelial function means better circulation not just during exercise, but throughout the day. Perhaps most importantly, Japanese programs emphasize consistency over intensity. Doing the right movements daily, even briefly, is far more effective than occasional long workouts. Circulation responds to frequency. Blood vessels adapt when they are reminded repeatedly to function well. There is also a psychological shift encouraged in Japanese aging care. Mild discomfort during movement is reframed as safe and temporary. Pain is monitored, not feared. This allows older adults to challenge their limits safely without retreating into inactivity. By this point, one thing should be clear. Improving leg circulation is not about supplements, gadgets, or extreme routines. It is about restoring a system that has become underused. The legs remember how to function well. They simply need the correct signals. In the final part, we'll bring everything together and focus on the single most powerful intervention Japanese and global research agree on for restoring leg circulation after 60. This is the method that consistently outperforms medication, passive therapies, and isolated exercises. It's simple, but it requires a mindset shift. And that shift can change everything. Now we come to the single most effective intervention for restoring leg circulation after 60. This is not a trend. It is not a secret exercise. It is not something invented for social media. It is the method that Japanese vascular specialists, geriatric doctors, and rehabilitation researchers consistently rely on because the evidence is overwhelming. Structured walking, done correctly, changes leg circulation more than any other intervention in medicine. But this must be understood clearly. We are not talking about casual walking. Strolling slowly while avoiding discomfort does very little for circulation. What matters is structured, intentional walking that challenges blood flow just enough to trigger adaptation. In Japan, this is treated as a therapeutic tool, not a leisure activity. The power of walking lies in how it stresses the vascular system in a controlled way. When you walk, muscles demand more oxygen. If blood flow is limited, discomfort appears. Instead of avoiding this signal, Japanese protocols use it strategically. You walk until moderate discomfort appears, then you rest briefly. When the discomfort fades, you walk again. This cycle is repeated deliberately. This process triggers angiogenesis, the formation of new blood vessels. Think of it as your body creating natural detours around narrowed or weakened arteries. These new vessels improve oxygen delivery, reduce pain over time, and restore endurance. No pill can do this. No passive treatment can replicate it. Large clinical trials have repeatedly shown that people who follow structured walking programs dramatically increase both pain-free walking distance and maximum walking endurance. In many cases, improvements exceed 100% within months. These are not marginal gains. They are life-changing differences. Japanese clinicians emphasize supervision or structure because most people stop too early when discomfort begins. Others push too hard and create fear or injury. The sweet spot is moderate, temporary discomfort that resolves quickly with rest. Learning this balance is crucial. If you do not have access to a supervised program, walking with a partner who understands this method provides similar benefits. Accountability matters. Consistency matters. The body adapts when it is challenged regularly, not occasionally. Frequency is another key principle. Japanese guidelines favor walking at least 5 days per week. This frequency keeps blood vessels responsive and prevents regression. Long gaps between sessions allow the vascular system to stiffen again. Walking becomes medicine only when taken consistently. Tracking progress is strongly encouraged. Japanese programs often use simple logs noting how long it takes for discomfort to appear and how long total walking lasts. Watching these numbers reinforces motivation and provides objective proof that circulation is changing, even before symptoms fully resolve. What makes this approach especially powerful is that it integrates everything discussed earlier. Walking activates the calf pump, engages the thighs, challenges balance, improves coordination, and trains blood vessels simultaneously. It is a full system intervention. There is also a deeper cultural element at play. In Japan, Walking is associated with dignity and independence in older age. Maintaining the ability to walk confidently is considered a core marker of healthy aging. This mindset shifts behavior. People commit to walking not because they are told to, but because they value what it represents. Many older adults fear that pushing through discomfort will cause harm. Research shows the opposite when done correctly. Avoidance leads to decline. Controlled challenge leads to resilience. The discomfort you feel during structured walking is not damage. It is communication. It is important to listen to your body intelligently. Sharp pain, chest discomfort, or dizziness are signals to stop and seek medical advice. But the familiar calf tightness that eases with rest is exactly the signal that stimulates improvement. When people begin this process, the first changes are subtle. Feet feel warmer. Swelling reduces. Nighttime cramps lessen. Balance improves. Walking feels more confident. Over time, endurance returns. Daily life becomes easier. This is why Japanese longevity research consistently links walking ability to overall survival, independence, and quality of life. Strong legs protect the heart. Active circulation supports the brain. Mobility preserves identity. At this point, you may realize something important. Your legs are not failing you. They are adapting to how they have been used. Change the stimulus, and they change in response. You do not need to do everything at once. Start with ankle movements. Add seated or standing activation. Then commit to structured walking. Build gradually. Consistency matters more than perfection. Your legs have carried you through decades of life. They have supported work, family, joy, loss, and countless ordinary moments that shaped who you are. Caring for their circulation is not about exercise. It is about honoring that journey. If you are already walking regularly, notice how your legs feel afterward. Has endurance improved? Has recovery become faster? Your experience may help someone else who is just beginning. The path forward is clear. Circulation can improve. Mobility can return. Independence can be protected. And it begins, quite simply, one intentional step at a time.